stressed by all your piling assignment deadlines? Those all-nighters causing you to have recurring headaches? Perhaps you decided to self-medicate as a temporary solution. Pop a painkiller and sleep it off. But what if it just keeps coming back despite the rest and medication? With the afternoon sun blazing, seeing a doctor is something you most definitely want to avoid. So you decide to take matters into your own hands. You enter recurring headaches into Google, and in the click of a button, you are provided with more information than you could fathom. You open the most recently written article in hopes of gaining insight into the unbearable pain you are experiencing. However, after a mere click, you find yourself looking at possible brain conditions and even brain tumors. Does trying to cyber-diagnose yourself on Google sound familiar? Cyber-diagnosis is the action of one Googling their symptoms and making use of the internet to diagnose themselves of the condition. Did you know that an article on The Telegraph recently reported that 1 in 4 Britons self-diagnose on the internet instead of visiting the doctor? When asked on what they do when they feel unwell or experience symptoms, the answer was, Google my symptoms. In today's age, where internet reigns supreme, you can pretty much find anything you want online. From health tips, how to lose weight, diet recipes, how to get rid of acne, or even how to cure sinus. And most common of all, do I have cancer? Now, let's look at the pros and cons of cyber-diagnosis. The pros. It is convenient and accessible. Today, with the convenience and accessibility of the internet, both the patient and the doctor can correspond 24/7. Busy with your schoolwork or rushing an assignment, cyber-diagnosis relieves the hassle of scheduling and setting doctor appointments and avoiding long waiting hours. It is also accessible to those who are physically disabled or unable to leave their home. Secondly, you can engage in a community. Many people are embarrassed or ashamed to reveal their conditions and symptoms even to a doctor. The anonymity that cyber-diagnosis provides could allow the patient to more openly share their symptoms and hence increasing their chances of correctly identifying the problem. Participating in forums and discussions could also help other patients to learn more about their conditions and maybe find a cure. Teenager Bronte Doyen, 19, was convinced that she was dying from a rare form of liver cancer after researching past cases online. When she told medics about her fears, they told her to stop Googling the illness. But tragically, Bronte died just 16 months after she developed the cancer. Lastly, it's affordable. Most of us would not see the need to visit a doctor for a minor headache or a small rash. However, based on the severity of the situation, we might feel that a doctor's attention is required. If the polyclinic is closed or inaccessible at the time, some might even turn to private doctors, which cost significantly more. Cyber-diagnosis could help you to further research and then find out if you truly need a doctor. For us teenagers, even $10 is precious. Now, the cons. Credibility. If no one knows who is treating whom, how is quality service then ensured and verified with the appropriate legal certifications? This also means that anyone can post their version of cure on the internet, and it's up to us ultimately to ensure we trust the right sources. Secondly, unnecessary stress and anxiety. Various symptoms could be linked to a wide spectrum of conditions. For example, a chronic cough could be linked to lung cancer. For people who just want to find a simple cure for a cough, could possibly be put under unnecessary stress after reading that they could be suffering from a far more serious condition. Such stress and anxiety could worsen one's mental state, delaying recovery. And the worst of all, incorrect diagnosis. Dr. Google could be dangerous. According to a survey reported by the Daily Mail, a fifth of among 1,000 women had at some time wrongly suspected they had a serious disease. One could also wrongly self-medicate themselves due to the misdiagnosis. After all, it does seem easier to go online for answers than to pay the doctor a visit. And the top 10 illnesses wrongly diagnosed using online advice includes breast cancer, other forms of cancer, depression, and even diabetes. While the top 10 symptoms that has prompted web searches include sleep problems, headaches, and depression as top 3. So, can Google be your doctor? We say why not? Of course, a certain amount of filtering has to be done to ensure that you get a fairly accurate diagnosis. My tip to you is to follow these 4 steps before you cyber-diagnose. 1. Assess the situation. If you are in severe pain that is impairing your mobility or inhibiting natural bodily functions, skip Dr. Google and immediately consult a doctor. 2. Search within credible sources. Only read and believe information given from a credible source. Follow these 3 steps to ensure credibility. Sources that has .org or .gov in their website should ideally be your first choice. Find out if the source or author has a strong reputation in the medicine industry. 2. Check the currency as well as frequency. Look out for the copyright year and the date of the latest post. Does the source post articles regularly? And lastly, check the purpose. What is the source's intentions? Are they giving objective or impartial views? Are the main points clearly and logically presented? And now moving on to the third point, do ample research. If you're experiencing more severe symptoms, be sure to research specific terms so as to derive a more accurate diagnosis. If you're attempting to self-medicate, remember to research on medical terms or head down to a nearby pharmacy. Fourth and lastly, ask around. Before you even decide to take matters into your own hands, spend some time consulting the close ones around you and ask for their advice and opinion on the diagnosis you have found. Well, to us mothers are always our second doctor. So remember, love yourself enough to live healthy. Don't assume, and a real doctor is always the best bet.